much for joining us here today. I'm Radha. I'm a partner with Unitas Ventures. Unitas is an early stage venture fund partnering with entrepreneurs who are leveraging tech to address big opportunities across healthcare, education, skilling, jobs, and financial services in India. According to Global Health Security Statistics 2019, India was ranked 57 out of the 195 countries in preventing, detecting, and mitigating and curing diseases. The challenges are many, but the opportunities hence are massive. Today, I will be chatting with Dr. Shravan about the state of healthcare in India. Dr. Shravan is the president and CEO of GE Healthcare India and South Asia and managing director, Wipro GE Healthcare at GE Healthcare. Hi, Dr. Shravan. It is my pleasure to have this conversation with you, to listen and learn from one of the best in healthcare in India. And thank you, Inc42, for the opportunity.
Thank you so much, Radha. It's a pleasure to be here. And thanks, Inc42. Very excited to be a part of this session.
Dr. Shravan, I think this is a very Indian thing, but even otherwise, all of us are asked, what do you want to be when you grow up? And also at several points in our lives, we ask ourselves, what would we have been if not what we are now? And interestingly, in my case, I've always wanted to be a physician or a musician. And because I think I really strongly believe that medicine and music have the power to cure. But yeah, it's good I didn't take either careers, good for others. Just curious, as a trained physician, what led you to not practice, but instead move to the world of business?
Yeah. Radha, first of all, I should say it's never too late to change and follow your passion. So if you're still excited about music, please go for it. As for me, I come from a family of physicians, my father, my grandfather, a couple of my cousins. So it was what surrounded me and what excited me when I was growing up. And I was really passionate about it. And I still remain very passionate about medicine. I went to Madras Medical College and I have some great friends from there. And I'm in close touch with what's happening in that space. But after the rigor of med school, I thought I'll try something different. I got a business degree in healthcare, specialized in health economics, and that took me through a very different pathway. I got into the corporate world, but I've always stayed very close to healthcare. I've been in the pharmaceutical business, in the lab diagnostics business, and now, of course, with GE Healthcare. It's a pretty broad canvas which looks at imaging, it looks at the digital side of healthcare. So, still very close to the action, still working with hospitals and governments and public health. So, in some sense, I still feel close to what I studied, but very much now from a business standpoint. And with that, I hope you'll call me Shravan for the rest of the conversation.
Definitely. And Shravan, I think doctors, physicians inherently are entrepreneurs, right? I mean, people usually have their own practice. They run their own clinics, and was just curious. Maybe one of the things that you would have seen through your career is exposure to business. I wonder if medical schools teach you basic economics and basic business. If not, they should definitely consider incorporating it.
For sure, Radha, I think they should do that. I think we could also benefit from courses in public health and medical ethics. I think that, along with economics that you suggested, would really help a clinician, whether they're in practice, private practice, or working with a hospital, or if they branch off into corporate life like I did.
Absolutely. Great. So let's get straight to it. I think the pandemic has kind of consumed all our lives over the last 18 months. For the first time, this is something that has changed everything for everyone across the globe, kind of uniformly, right? Unlike any other crisis that the world has seen. One thing it did was also expose the weaknesses of healthcare systems across the globe. So, what were some of the big challenges you think India faced, and what did we do well that maybe other countries could emulate?
So, rather, it was a bit of a mixed bag here because I think we did pretty well in some areas. But simply, if you just consider the geography, the vast geography of India, it's really hard to manage a pandemic. And we have so many different categories of cities and population. Some of them have immediate access to healthcare. Some of them have to trek several kilometers to find good healthcare. So that by itself is a challenge. Infrastructurally, medical facilities, the number of doctors, nurses. This is something which we've always been talking about, but that became very stark during the pandemic. So also information kept changing. We were getting a lot of new inputs from other countries and from our own country, and of course some misinformation was also being spread at that time, and that was also a bit of a struggle. I'm always keen to identify ways to empower patients. Right, patients need to know, need to have information. They need to have the right information at the right time and be able to act upon it. And I think we've taken a lot of steps since then. To your question, there were some things that we did well, although we criticized it at the time. The very strict lockdown that we had as soon as COVID broke out, um, a lot of people struggled with that across the country. But if we had not done that, can you imagine how things might have been in early or middle of 2020, when we did not have enough facilities, when there were not enough vaccines or medicines to treat people. So, in some sense, the lockdown did work. I've also got to say the regulatory framework was fantastic. The government was very open to new technology, whether locally made or imported. They said whatever it takes to get testing across to the population and whatever treatments are available. And they experimented, and in some cases, it did not go so well. In some cases, it did go well. But when you're in an emergency situation like that, you have to try whatever it takes. You also mentioned a bit about the entrepreneurial spirit, Radha. I think we've created a host of new medical entrepreneurs in this space who've brought in new products and new services, and a whole new culture of awareness into healthcare, which was triggered by COVID. So I'll just give you one example. Telemedicine. We've been talking for 2 decades about telemedicine. Now, thanks to COVID and video calls, telemedicine was the way that most patients communicated with their doctors during the lockdown period, and a lot of that is here to stay.
Yeah, yeah. No, I think one thing that it has done to everybody, like I was mentioning, is bringing change in behaviors. I think some of that was by force, and some of that, I guess, was just necessity, right? And the fact is, it took a pandemic to take the population digital and online. A lot of people were still very comfortable only consulting in person, and now they're a lot more comfortable connecting via telemedicine platforms. Physicians, for example, a lot of them honestly did not even see any incomes, right? Because patients weren't really walking in, and they, from their livelihood standpoint, I mean, not like it's different for them, right? So for their incomes, I think their acceptance of technology and seeking out patients online also helped significantly. And I think hospitals also started to kind of adopt tech platforms a lot more faster. So the entire thing has changed behaviors of all stakeholders, and also done it in a very accelerated manner for the good of the larger population. So I think that's definitely great. What country do you think handled this much better than us, Shravan? And anything we can learn from, I mean, anybody, any other economy?
First off, I'll say there's a lot that we can learn from
Yeah,
ourselves.
yeah,
Between the first wave and the second wave, the response to COVID was starkly different, and it seems a little paradoxical because COVID wave two appeared to be much worse statistically. But if you
correct.
think about the readiness, the technology that was available, the protocols that doctors were following, the new medicines, the vaccines, there was just a lot more going on. It was unfortunate that it got away from us for a few weeks, but then we were able to pull it back together because we had learned a lot from our own experiences in the first year. Having said that, again, it's been a mixed bag with different countries. Some of them have done very well, some of them are still struggling with it and have not reached baseline levels yet. But the smaller countries, they had the benefit of size. Like a Singapore or Australia, although it's a large country, it is low in population, and they were able to enforce some tight lockdowns and quarantines. They were able to enforce mass testing and screening procedures. China was very strict in its enforcement also. Countries like Israel and other European countries, they deployed a lot of technology, remote screening, remote monitoring. Again, we talk about tele medicine, remote ICUs. The US and UK, they deployed their vast investments in pharmaceutical technology, developing new medicines, accelerating clinical trials, developing a vaccine. It's
Yeah,
just so remarkable that we have not one but several vaccines
no,
just a
absolutely,
year and a half into the
absolutely.
pandemic, and that is just
Yeah.
absolutely tremendous, and that's benefited the whole world.
Right, right. No, I think you bring up a very nice point, which is obviously the things that we learned from our own experience has actually led to a lot of somewhat of preparedness and containment. I'm very sure it might have been worse. I know it was already brutal, but the fact is that things would have been worse if we weren't even prepared to that extent. So yeah, you're very right. So I just want to, I mean, maybe move on a little bit and talk about the fact that maybe all of us are kind of slowly learning to live with COVID. A significant portion of the population is somewhat vaccinated. There is some kind of awareness, though I think in general the awareness has to be a lot more across the spectrum, right? Not just COVID, but healthcare in general. But there is awareness, and people are a lot more conscious of how they, behave and conduct themselves in social gatherings and things like that. The bigger question that I wanted to bring up is, how during COVID and currently, like, how do you think the contribution of Indian startups helped, just in general, managing COVID? What kind of impact do you think they saw, and how did they contribute to the revival? As we are getting in to somewhat of pre-COVID levels.
So startups have been very much a part of the healthcare ecosystem already, right, prior to
Yeah,
COVID. And one thing that we've realized is no one entity can really make a tremendous impact by itself. And we
absolutely.
all coexist with each other. And if you're looking at the entire patient journey from screening to diagnostics to therapeutics and eventually monitoring, um, different members of the ecosystem play a different role. I think in India, there's a very strong entrepreneurial spirit, and when there is a business opportunity which can also help improve the lives of patients and communities, I think that's a perfect combination. So we saw a lot of people getting into the testing space initially when there were not enough credible treatment choices available, and everybody was focusing on testing. We saw a lot of companies get into that space. Molecular testing, rather, if you recall, used to be frightfully expensive. We were talking about
Yeah,
4,000-5,000 rupees per patient. And if, like me, you're tested almost every month, every time you step outside, you're talking about maybe a couple of tests a month, and
yeah,
4,000-5,000 rupees was too much. But now it's down to a few hundred rupees, and it's become a fairly routine procedure. So not only has that reduced the cost of PCR testing, it's also
correct.
created a whole new industry of molecular diagnostics, which was sort of only available to certain labs and hospitals at the time, but now
Correct.
it is ubiquitous. Similarly, you see that in medical consumables. You see that in pharmaceutical products. You see that in the medical devices, monitoring equipment, ICUs. So a lot of these have been spawned by startups, and eventually, I know we'll be talking about some of the Edison startups also, and I can share some more details on that.
Yeah, absolutely. And I think on the devices front, for example, itself, right, a lot of us might have had, even the urban households might be familiar with using a thermometer, where we would have made, at the very least, had a thermometer, and maybe there was a diabetic in the household. And so you had, the glucometer at home. But then I think what the COVID really did was to also in many ways kind of spur this thing of households understanding and also keeping, for example, a pulse oximeter, right, and the ability to do some basic diagnosis, like you were saying, at the point of incidence or a point of care, and at the consumer or the patient end is actually really big. And I think that opens up obviously a whole host of opportunities for entrepreneurs to kind of work on, right, like to just enable that. Yeah, and this is a great segue into talking about what GE does in the context of innovation and working with startups. I think there's a lot that people would like to hear about the Edison program and all the support you provide to startups via the Edison program. So yeah, please could you share a little bit about that?
Thanks, Radha. One of the things that we're very proud of at GE is we have a very strong technology center right down the street from where I am in Bangalore, where we have about 2,000 engineers, and they are developing products in India, for India, as well as for the world. And it is across the spectrum. We have imaging, we have ultrasound, we have the life care solutions, the critical care products. All of these are being developed and enhanced here. And along with that, we also have a very strong technology arm where we're connecting these devices digitally. We're making electronic medical records come alive through our digital partnerships and enabling hospitals and eventually empowering patients. That's what we're doing here. We have an entity called the Edison Accelerator. And just as in general in healthcare, no one entity can do everything all at once. We've also recognized at GE that we need to partner with the startup ecosystem because they are just so responsive and quick to bring products to the market, and they're also able to understand what the needs are, and we are able to partner with them. What we offer as GE is access to our data, access to our technology, access to some of our partner hospitals so that they're able to look at real world evidence. And rather, this is absolutely crucial. When you are a startup and you're trying to bring a product to market, they need to be able to demonstrate proof of concept using real world evidence, and that is something that we are able to facilitate through our network. And so we bring them on board and sort of in a way mentor them and share ideas, share concepts, and then we're able to help them get deployed to the healthcare ecosystem at large. This slide has an
Yeah.
example of some of the companies that we have onboarded. I know you're familiar with a couple of them. Would love to hear about your experience with them as well. But I'll share specifically, for example, Predible. We were talking about COVID in wave two. Rather, we realized that one of the stark differences between the previous year and this year is that we saw a lot of uptake of CT scan usage
Correct.
for to go along with the RT-PCR test. Patients also needed to check their high resolution CT scan results. And the number of scans that some centers were running, it just became very difficult for the radiologists to cope with that level of capacity. So we deployed this app called Predible, which uses certain AI technologies to help read the image and offer a score and a diagnosis, which can then be confirmed by the radiologist. So this could reduce the radiologist's time and effort by about 50%.
Yeah.
And we deployed this across the country. And this is a patch that can be added to any CT scan. Similarly, we had some products also for X-rays. And this is remarkable how it, very quickly we were able to deploy this and have this used in collaboration with GE and other folks also. Similarly, what we do is we have certain themes depending on the medical need at the time. Right? If oncology is a priority area that we are working on, we invite companies that have some experience and some work in developing products for oncology. It could be in the genomic space, it could be in image recognition space, other clinical decision support tools. So that might be the flavor of the season at one point. It could be something else at another point, cardiac care and so on. So based on the critical need of the hour, we put out this request, and then we invite companies to pitch, and then we select a handful of them that we then nurture to the next level.
No, it's actually really exciting, Shravan, and I think GE is doing a fabulous job of working with early stage, innovators. And I think, like you rightly said, I mean, no single entity, whether it's the government or the corporates or the private enterprises or even startups, can kind of solve for the challenges that the country faces, right? And especially healthcare is one of those really complex sectors. And just to talk about both 5C and Credible, I think, for us at Unitas, our thesis is to back entrepreneurs who are solving for the three fundamental challenges with healthcare, which is access, affordability, and quality. And I think both Credible. You spoke about what Credible was doing. I mean, clearly it is about making access possible and efficiency in terms of affordability, right? So the idea is improve the efficiency of the radiologist at the back end, also improve the quality of reads by having this AI engine do a lot of the initial reads, right? And I think the turnaround times were really rapidly improved because of that. And 5C, on the other hand, is actually a horizontal digital diagnostics platform, and you're aware of that as well. They started with radiology, bringing radiologists and their expertise to clinics and diagnostics centers across India, and 63 or to 65% of their clients actually come from tier 2, 3 India, from really remote parts of India. And so really providing them with access and access to affordable quality care. And I think ability to work with a GE on multiple fronts, leverage your expertise is really great. But while on that point, Shravan, one other thing, can you talk a little bit about GE's internal AI strategy? You're obviously working with all these startups depending on your focus at that point in time, like you said, oncology, radiology, whatever. But do you have what's GE's internal AI strategy?
Yeah. So I think you correctly observed there that we work with multiple entities. So our internal strategy is still very much to work with third parties
Okay.
if we must, but we're also developing a lot of the tools in-house. And
Okay. Okay.
broadly, we're looking at AI and machine learning in the area of oncology for clinical decision support. We're also looking to, what's happening in the technology world around us. Is there something we can do with 5G networks now
Yeah.
that there's a chance that that could be quite ubiquitous over the next few years? We want to see how we can participate in that space. We are focusing on a few therapeutic areas now, particularly oncology, since we're seeing a lot of that with the aging population. We're seeing a convergence of imaging as well as in vitro diagnostics, as well as therapeutic agents and precision medicine. So, if you consider precision medicine, you're looking at a tremendous amount of data from various population sets, and then you use that data to be able to predict the outcome for a patient and then develop a very specific and personalized healthcare pathway. So in order to do that, you need a good amount of data sciences to support that the clinical decision support pathway, and that's one area where we are very actively engaging our technologists to see what we can come up with.
Yeah, and for the benefit of folks who are listening in, Edison is a program across India and South Asia, is it? And it's not necessarily only limited to India. Can you share a little bit about that?
So, as GE, we are part of a global ecosystem.
Yeah,
We
yeah,
have offices and technology centers around the world. For us, it is very fungible. We share our inputs around the world, and each of the business units here and the functions within Edison, they have a global relationship as well. So as far as I'm concerned, we are part of the global ecosystem. We happen to have a center here, and whether we are getting inputs from across South Asia or otherwise, for us, it's the quality of material that matters and the impact that it can have on patient outcomes. That's what we are looking for, and we are very open for that.
yeah, yeah. No, that's really good to hear. Just shifting gears a little bit to how the future would look. One of the proxy metrics for to show the health of the population is average life expectancy, and clearly with advancements in technology, with right policy, regulatory interventions, life expectancy has more than doubled over the last century, and today it is between 60 and 80 years, right? And a fascinating thing that I heard from one of your talks, which was really very interesting, was the child that is going to live 150 years is already born. And that's, in so many different dimensions, it's extremely exciting, right? Obviously, a lot has to change between now and 100 years from today, but can you talk about what may be pivotal for us for this to happen? and specifically about maybe 3 or 4 opportunities for healthcare innovators who might be interested in, being a part of the future of health tech.
First of all, Radha, I'm delighted to know that someone listens to these webinars. Thank you.
Absolutely, that was a that was a very very informative and good talk, Shravan. There are many more people who have listened in and benefited. So
And I would actually challenge that statement myself, my own statement, and say that it's not just life expectancy that matters, but quality of life also that we have
yeah,
to consider.
yeah,
Right? So
yeah,
today we have populations in different countries living between 60 and 80 years. But the immediate challenge is to ensure that at that age, 70, 80, 90, 100, they also enjoy a fairly good quality of life, not
yeah,
just longevity. And I think that is what should inform us as that child eventually grows up to 150. Rather, if you look at it over the last 100 years, there's been a huge amount of technology, right? New surgical interventions, new medicines. There have been treatments that have been invented for diabetes, right? Which
yeah,
is so we take that for granted now, but 100 years ago, diabetes patients with diabetes did not have very many years to live, and
right,
more recently we've had some amazing treatments for cancer, which 25, 30 years ago, the life expectancy of a patient diagnosed with certain types of breast cancer or leukemia may have just been a few years. Now
right.
they can be treated and live a near normal life, and have a fairly robust life expectancy. But the most um, impactful intervention for life expectancy has actually been public health, right? So
Hmm.
mass
Hmm.
vaccination, mass screening programs, hygiene, these are what have had a very very significant impact on population health. An individual may live long, but for a population to live long, you need public health interventions. And that's where I hope to see a lot of the investment going towards, a, public health, B, preventive health, and C, precision medicine. So the three P's, I think, are going to have a very significant impact on both the quality of life as well as longevity.
Yeah, I think you're absolutely right in the fact that it is not simply about longevity, but it is about the quality of life. And I think very nicely summarized as 3 Ps. But going back to one of the things that you mentioned, a lot of this really depends on awareness and education. And if you're talking about public health, I mean, clearly the government has a huge role to play in it. So, how is the government enabling this today, and what are some of the key policy and regulatory, changes that you would like to see? I think more in terms of what would be required to take us from where we are today to at least adding a couple of, decades to that longevity and way more to the score on quality.
So, Radha, I woke up this morning to news that our government is investing 64,000 crores in healthcare infrastructure, and that is the best news I've read in a long time when it comes to healthcare, public spending, and public health initiatives. As I said, it's not just medical technology and various inventions and surgical techniques, but you need a public health approach if you really want to make a dent on population health outcomes. So that is a starting point. Investing in healthcare, investing in the right type of healthcare is critically important. You spoke about access, affordability, and quality. And some textbooks refer to these as the iron triangle of
Okay.
healthcare. and
Okay.
um, and they say that you have to have these, and there's a bit of a rigid stance to that. I think these are constantly moving, right? Our concept of quality is constantly changing. What was acceptable 25 years ago is not acceptable anymore, so that is moving. And what about affordability versus quality? I can give you a very cheap treatment, or medical intervention, or an imaging process, which may not have the same quality or outcomes that you're looking for. So we need to think
Yeah.
about
Yeah.
what is the right treatment at the right time for the right patient, and what is the best technology available. How can I make that more affordable? How can I make that accessible? Access is often confused with cost.
Right.
Again, I could deploy one of the finest MRI machines in a town with no technologists or radiologists and say that, okay, I'm giving it to you for free. But if it's not going to be used, then what's the point? So that brings me to the other area where the government should think about investing, which they are already, to be fair, is in education and skill building. And
Right.
this is actually something that GE Healthcare is already very active in. We have a team that is dedicated to skill building, and we
Mm-hmm.
work with various state governments. Recently, we've been working with the Sikkim government, Uttar Pradesh, Goa, where we are skill building thousands of young medical technologists and healthcare workers to make them better prepared and better employable in the healthcare ecosystem, so that we're able to address any potential surge of patients that are coming our way. Another thing that's very important now, Radha, is the last 18 months we've been talking so much about COVID. um, there have been the other diseases are still carrying on, right?
Yeah. Yeah.
Patients still have are falling sick with cancer, cardiovascular disease, and so on. We need to make sure that they get the help they need, and they are put back on priority, and we need to have a healthcare policy that addresses that requirement. Lastly, I'll leave you with the regulatory framework. I alluded to it earlier. It's a pretty sophisticated regulatory framework that we've now developed in India. We need to continue to build on that, learn from some of the best practices, ensure that we have access to the best products and technologies in the world, and be able to freely transact, so that we're able to get the best technologies to the patients that need them as quickly as possible, while we are still nurturing an innovative ecosystem within India for product development and manufacturing. We have to remember that healthcare is a global issue, and we need to make sure that the priority should be to get the best technology, best quality, make it accessible and affordable to patients across the country.
I think, as that was actually exactly it, right? I don't think any problem is, let's say, possible to be solved by just one stakeholder. I think, especially the magnitude of these problems and the kind of depth each of them go to, you really need to collaborate, work together to make change happen and to create impact. And like I started, I know medicine and music have the power to cure, but money and math, not necessarily bad. Math in terms of tech, I think, can definitely help make that happen. I had a fabulous time chatting with you, Shravan. Thank you so much for taking the time here, and thanks, Infort, for the opportunity.